Hi, this is Dr. A with your Intro to U.S. Healthcare, Chapter 4. We're going to look at public health's role in healthcare, and we're using the 5th edition of the Basics of the U.S. Healthcare System by Nancy Niles. And so we're going to continue. This is part 2, and we're going to look at health education promotion and the SDGs coming up. So, public health education and health promotion. So health education is changing high-risk behavior through education. And so an example of health education would be an anti-smoking campaign or an awareness of how HIV spreads awareness campaign, something like that. And health promotion is a broader term that encompasses community, environmental, and economic interventions to promote health in a community. The focus of public health education and health promotion is on changing social determinants such as lifestyle behaviors, but it can also target, other, built environment and things like that. So, but with health education, of course, you want to target individual lifestyle behaviors, especially if there are high-risk behaviors. And so you can have public health education campaigns around different behaviors that maybe are more prevalent in a society. And so if we look, for example, even just at smoking. So I mentioned smoking. The smoking rates in the U.S. are not bad compared to some other countries around the world. And, some countries have smoking rates as high as 25% of the population. In the U.S., we're like 10-ish% of the population. But we could do better. And so you can have public health education campaigns around smoking, not starting to smoke, quitting smoking, etc. Of course, we need to also evaluate if those programs are effective, if they're targeting the right audience. Having a stop smoking campaign let's say in a gym may or may not be the right area, because people that go to the gym are typically already, seeking healthier behaviors. But having one around schools might be a better environment, because then maybe we can prevent them from smoking in the first place. So social marketing for public health education and health promotion draws from the business discipline of marketing theory and then adds the science-based health strategies of promotion and prevention. And so in the business world, what you need to market a product is a marketing mix. So you need a specific product at a specific price. We want to market it at a specific place with promotion. And then you also have for public health education, you have the public's partnership, the policy, and the purse strings. So who's funding it? What health policy might be driving this? Who can we partner with? Are we partnering with schools and educational institutions, or are we partnering with businesses, or are we partnering with hospitals, right? And so again, it's the same thing, like I said, with the stop smoking. It's like if it's a campaign of don't smoke, never start smoking, then you would want to promote that in the schools. And how do you go about doing that? What's the most effective way? How do you design the message, etc.? So this involves creating, communicating, and delivering health information and interventions using customer-oriented and science-based strategies to protect and promote health in diverse populations. And so again, where you disseminate the message and how you disseminate the message and what the message is really important for it to be effective. And we can use social media to do that. And so you want to do first a market research to determine what are the key educational messages that are needed. And you want to review social media sites by user statistics and demographics. So, for example, if you want to target an older generation, you are probably more likely to be successful if you target Facebook, because there's a lot more older generations on Facebook. Of course, some of the older generations may not be on social media at all, so you may have to use TV ads or something to just find where they're at. But if you want to target a younger generation, you may have to use TikTok or you have to use Snapchat, or you have to use Instagram, right? And you want to start a social media campaign by using low-risk tools such as podcasts or videos. So they're low risk because users can choose to just skip, not watch it, and all of that. So there's no forcing the message on them if they don't want to read it or to watch the video or listen to it, whatever. They can just skip and just go on. But of course, the educational message must be based in science and accurate, factual, etc., and also well designed to have the appropriate effect that you're trying to achieve. All right, our second topic in this lesson is the United Nations Sustainable Development Goals, or the SDGs. And the UN adopted these SDGs, or global goals, in 2015. There are 17 goals that are focused on ending poverty and protecting the planet so that by 2030, people would enjoy peace and prosperity. Worthy goals. So, the goals in order are: 1, no poverty; 0, hunger, for number 2. 3, good health and well-being. 4, quality education. 5, gender equality. 6, clean water and sanitation. 7, affordable and clean energy. 8, decent work and economic growth. 9, industry innovation and infrastructure. 10, reduced inequalities. 11, sustainable cities and communities. 12, responsible consumption and production. 13, climate action. 14, life below water. 15, life on land. 16, peace, justice, and strong institutions. And 17, partnerships for all the goals. So those are some lofty goals, and so there's a lot that can go into each goal. And if you want to dive deeper, you can look up these SDG goals on the United Nations. The United Nations evaluates the member countries' progress on each of these goals. The score represents a percentage of the SDG goals that they have achieved. So in 2022, the highest scores were achieved by Finland, Denmark, and Sweden, with scores of 86.5%, 85.63%, and 85.19% respectively. So those are high achievement. They have a lot of cool things going on in those countries, and they're all near each other. The lowest score was 39%, which represented several countries, including South Sudan, the Bahamas, Libya, and Palau. The U.S. score was 74.55%, which is not bad. It ranks us as 41 out of 163. Of these goals, Goal 17, the partnership for the goals, is the main focus. It is because it represents collaboration, as well as Goal 13, which is climate change or climate action, because it is recognized as a threat to the global environment. Although all of the goals are important, of course. And so, okay, so this was a shorter kind of middle lesson on the SDG goals and on health promotion and social media. And I have one more lesson for you for Chapter 4, and we will see you in that one.